to start us off is some logistics. So today we're going to start with me introducing our virtual town hall, introducing both of our panelists, but also moving it forward to give a slight overview of what we're hoping to do tonight, as well as letting you know that we're going to, Nick and I are going to start the conversation with questions with Dr. Wooten. And once we're past that point, we'll be fielding questions through the chat. So I'd like to ask you to make sure that when you do a question through the chat halfway through this, we'll take questions probably about 7:30, to make sure that you're sending them directly to me, not the entire group of people on this call, just to make it easier. So when you get into your chat button, make sure that you change it to me as the recipient. So as you all know, the last 8 weeks have been extremely unique for all of us. This is a scale, a pandemic that none of us have experienced in our lifetime, and a clear opportunity for public health to have its voice heard, to have a role in making changes and impacting our population. And I have to say that none of us expected to be in that role at this point, but it is really an important role for us to be playing and understanding. And I want, with all of our students on, we have over 100 students right now joining us. It's an opportunity for you to understand what your role is as a younger generation, as public health professionals of the future. I also want to mention that San Diego's always been unique in the way it does its work in public health. We have an extremely outstanding leadership that it has always been ahead in its approach. So we've had our Live Well San Diego vision for the last now decade that has been really emphasizing population health. And this has been no different in what's been done. And I think the fact that we have both Mr. Nick Macchione with us and Dr. Wilma Wooten speaks to their dedication to our student population and educating the public health workforce of tomorrow. So I'm going to start by introducing both of them, and then I will pass it on to Nick to start us off on this discussion. So Nick is a man that needs no introduction most often in the world of public health and in San Diego and around the country, with his visionary approach to the work we have done in San Diego in public health. He leads our San Diego County Health and Human Services Agency, not just public health, for those of you who are in public health, understanding that his role is significantly bigger than that in San Diego. The agency has over 6,700 employees. It's a $2.6 billion agency, and it really has the impact on everything from housing to public health service. So the scope of the work that he does and the vision that he's had for San Diego is truly inspiring. I don't want to spend too much talking about what his background, because a lot of you can read that online. What I want to talk about is how he's impacted San Diego through the work that he's done leading this concept of Live Well San Diego. And it's been really a unifying vision for all of us who work in public health. And for our, not just public health, but all of the other sectors, from business to school to all the partners that I think last time I looked, and I should have looked this morning, but I didn't, we're over 450 partners. And Nick, please help me if I'm wrong on my numbers here. But it's a really massive effort for the county and has been extremely, extremely beneficial to all of us, and visionary, and something that people look to. Dr. Wooten, one of our alumni of our joint program with UCSD for family medicine, for preventive medicine, she had her MPH with us, but Dr. Wooten is the public health officer for the county, has led the efforts on this pandemic, and I can't tell you how grateful I am that she is taking the time tonight to be with us. As this is uniquely a time that she is on the front line every day, dealing with all the issues of the county. But Dr. Wooten has also led our efforts in everything related to public health in the county, obviously. She's been serves also on multiple boards, including the schools board for advisory board for the school. But one of the roles that I personally think is extremely, everything she does is extremely valuable, but one of the ones that really speaks to me is her role on the Public Health Accreditation Board nationally, because it's one that standardizes a lot of the work that we do nationally for counties and health departments. So I'm thankful again for both of you being here with us this evening. I'm also want to point that this is a unique opportunity for us to discuss what's being done in San Diego specifically. So I'm going to turn it over to Nick. Thank you again, and then we'll start fielding questions.
Thank you, Dr. Madanat, and good evening, everyone, and thank you for being part of this virtual town hall. Special part of my heart, obviously, for an important institution, the School of Public Health, which I actually also hold appointment to in the Graduate School of Public Health. So great pride of us public health Aztecs, what we do, and particularly to Dr. Madanat, who is not your typical director, but with her leadership and the faculty, I will say, in our school, Graduate School of Public Health, across all our divisions, and even our School of Engineering, who's worked on a robotic ventilator. It's been really, really heart-wrenching to see how great the pouring out of support and offering of help immediately from our school, and really the tone led by Hala and our president with Adela as well, and her team. So thank you immensely for this opportunity. But really the front and center of this evening is our extraordinary leader we have with Dr. Wilma Wooten. Dr. Wooten reports to me, but not in public health crisis. No one reports to Dr. Wooten. She is literally in charge, and if you're familiar with how laws are here in California, but in all states, that in times of public health crises, indeed, the highest ranking individual is the public health officer, because that individual, and she'll be the first to talk about it, that does it in teams and the collaboration and the partnership, but it does come to that individual on her shoulders about the whole well-being of the 3.3 million San Diegans, and takes it, I will tell you, with every inch of her body and soul of her body, about doing the right thing and protecting the public's health. So we're going to go into a conversation with this extraordinary leader and more about her leadership, and I will say, jokingly, battle-tested, because this is by far perhaps the greatest challenge, and I would say the greatest challenge for any one of us in our careers. And we hope we don't see another pandemic in our lifetime. But we know they will happen. And for our careers, starting for me, and I know Dr. Wooten, from HIV and AIDS, to SARS, to West Nile virus, to Ebola, to hepatitis A outbreak, meningitis outbreak on the campus that we worked to COVID-19. In all of those, what's in common is having a very strong public health infrastructure. So I will tell you, public health is on the world stage right now. And it shows those that have really built the type of capability, both from a leadership, a workforce, an infrastructure, public health accreditation, thank God. We're accredited in many public health departments at the guidelines. But what it's really showing is, sadly enough, the woeful inadequate investments in public health and in public health prevention. And we know this as students of public health, but clearly in our response. And so what's extraordinary in San Diego, and we'll be talking mainly about San Diego, is that despite that, we took some very decisive actions. And this is because of the courageous leadership and having a broader lens of population health. And as Dr. Madanat said, Live Well San Diego, we already have been disciples about population health and looking at across sectors. And we'll talk in a moment about how that has influenced actually our response and how perhaps the greatest ingredient of success in dealing with pandemic is having a population health framework in action when it comes. But first, it starts with leadership. And so to Dr. Wooten, and I'll do this in the course of her a little bit. She's quite shy. I know you see her. She's the most common celeb on TV and the interviews. But she doesn't like talking about herself, but she is an extraordinary leader. And so in the course of just first opening up, Dr. Wooten, I'd love to, if you can, talk about what attracted you as both a physician, MD trained, and also MPH trained. What attracted you to the field of public health? And where this is going to go to is, and if you knew what you know now back then, would you still go in public health with all the challenges you've had? But first, if you may, what attracted you and a little bit about your journey?
Well, I'm originally from Alabama, rural west central part of the state, halfway between Tuscaloosa and Meridian, Mississippi. So I come from a very meager background and just have actually always been interested in public health, even before I knew what public health was. And I can think of examples of things that I was interested in or things that I wouldn't do when I was growing up, like drinking after people. That was something I did not do, not knowing that was the right thing to do to prevent spread of disease. But the very first thing that I heard about when I was probably in middle school was a diphtheria outbreak that was close to where I was. Given my age as a baby boomer, I've had all of the, the most common childhood communicable diseases, chickenpox, measles, mumps, and survived them. But today we have vaccines for those diseases, and there should be no reason why any child should experience those diseases, because the complications, while I was lucky and did not have any complications associated with those common infections, children can die from any of those, from measles, from chickenpox. So vaccines are important. And again, before I even knew what public health was, I was very cognizant of that. So public health has been an interest of mine on various levels. I really was interested in public health from a population perspective related to sports medicine. I've been interested in infectious disease, but then took a turn and became interested in sports medicine from a population health perspective. So I've always, even throughout medical school and my journey through my residency, have had an interest in population health.
That's great. And then that question, if you knew what you know now back then, would you still go in public health?
Absolutely, I would. I would. I enjoy my job. I enjoy the purpose. It's purpose-driven. As a medical provider, it really is that relationship with one-on-one, but when you're in public health, it's really your relationship with the entire population, and not your direct relationship, but the benefits that you can bring to the table for the population at large. So for that and many other reasons, I would choose public health again.
So let's jump into the issue about COVID-19, and I hope everyone is safe, and to your family and friends, you're helping convey the very important messages we've been conveying about protecting yourself and your loved ones and your neighbors, because we'll be talking about in a moment. It's working, and almost primarily with no vaccine. It's really what the public health doctor and Dr. Wooten's orders have put in place that has made San Diego stand out of truly one of the most amazing communities, as the 5th largest county, to put it in perspective, the 7th largest city in the country, and having some of the best results and flattening the curve, as we referred to. But Dr. Wooten, let me take you back now, roll it back into early February and even into January. It seems like it was yesterday, but we were with great horror watching what was happening in Wuhan, China, even in December and January, and raised anxiety, but no one really thought it would make its way in the way it has into the States. But something different for San Diego happened because we have a military base. And I'd like, if you can, to talk about when you got that call that San Diego was going to get its first COVID case. Not that we knew, but not because it came from within. It was flown in from Wuhan for folks that we had. So can you talk about the journey that started, and then the magical, I think will be a memorable day for you on Valentine's Day, not because you had a Valentine's Day, but because I think you did something extraordinary on that day. So if you could talk a little bit about that, and then we'll turn it to Dr. Madanat for the next question.
Well, regarding the first question, the historical event that happened here in San Diego is that San Diego was selected to be the recipients, I guess you could say, of repatriates that were being brought out of Wuhan City in China, Hubei province in China. And those individuals were brought to our Miramar base here in San Diego, and there were two facilities, two buildings, where individuals were placed as one, and then families were placed in another building there. And actually, that was the first time I actually had gone on campus as a result of this experience. And both of the buildings had both a gate lattice chain, as well as a see-through, an opaque wall, if you will, around them, so people couldn't peer in, because the individuals were on federal mandated quarantine, so they couldn't veer off of the location where they were. So that was for a period. They had to be there for 14 days. We did have two cases. Our first two positive COVID-19 cases came out of that group of repatriates. And there were a lot of patients under investigation. There were 7 individuals, I believe, hospital at UCSD, 7 at F.A.C.H.E, and we had 2 children at Rades. So it was a very challenging experience, but the team here in San Diego, along with CDC, Homeland Security, ASPR, it was really a great team, and we really got through that process. And I think that was the reason why we were selected to receive yet another group of individuals that were from a cruise ship. So, but what happened before the second gift that we received, we just realized early after the whole experience with Miramar that we might be selected again because of the way we handled that situation, but also knowing that the disease was spreading throughout the U.S., it just made sense to declare an emergency so that we could have a relaxing of contracting requirements, and just to have things in place in case things got worse. And that was, I feel, probably one of the best things that we have done throughout this entire COVID-19 journey, because it really set the stage and set us up actually to be successful.
Thank you, Dr. Wooten. Dr. Madanat, let me turn to you.
Yeah, so a couple questions that are related. One is around how does the county prepare for something like this pandemic? And the other part of the question is related to what I introduced in my introduction, which is the liberal San Diego vision and how it plays a role in this approach that you're taking in making decision around the pandemic and how to handle it for the population.
Well, I'll turn it to Dr. Ruth for the first question. I'll help on the second one.
So in terms of preparing, you know, since 2001 and 2, when we had the anthrax scare, the federal government started providing funding support to local public health and state public health jurisdictions to prepare for disasters, and not man-made disasters, but biological disasters. And there was always the talk of the next pandemic, and everyone thought it was influenza, and we actually did have an influenza pandemic in 2009, but it was nothing to the level that this pandemic has afforded us to experience. We've not seen the likes of this before, and I guess unless someone is over, say, 105 years of age, no one else has either. So this experience is a once-in-a-lifetime experience, and I think as graduate students trying to be involved in some way, I would certainly encourage you all to do so. Right now we are recruiting volunteers. We have a medical reserve corps for medical professionals, but we also have a volunteer program for students, graduate students, undergraduate, fellows, residents, as well as physicians. And the opportunities to be involved with this pandemic, there are so many opportunities. So we operate through an incident command system. We are now at the Emergency Operations Center, and within that Emergency Operations Center, we have a Medical Operations Center, which is the focus and the really heart of all of the medical operations to support the Emergency Operations Center. The EOC involves activities from law enforcement, fire, public health, Department of Environmental Health, and even other community partners. It's different though from when it's open for a fire, because those things are self-limiting, and they might last for a couple of weeks, but it's self-limiting. For this particular pandemic, we know that until a vaccine is produced, we will be in some mode of response until that occurs. Right now, we probably are at the peak, maybe on the slight down slope, but cases will still occur, because if people are coming and going, being exposed to others that might be infected, and the 14-day incubation period, we may continually see cases until a vaccine is developed, and we don't anticipate that a vaccine will be developed until early next year. So we're in for the long haul here. We don't expect that there will be any major events or concerts during the summer, as is normally expected. That definitely will not be a Comic-Con this year. This is a pandemic. It is a worldwide event, and the more that we can, as we say, use the term flatten the curve to sustain things until a vaccine can be developed and we can achieve herd immunity. We're going to be in a very different way of life, I believe, for the next 9 to 12 months.
And just to build on that, and then to address Dr. Madanat's question about live well, but even after the 8 or 9 months, there's a new normal. It's been extraordinary to observe that something unattended took place during our COVID, and that was almost an immediate drop of our seasonal flu, because of the precautions that people took, and maybe getting back to good hygiene and the good old-fashioned public health can help us even with other conditions in the years and decades to come. But to Dr. Madanat's point about what really stood San Diego different from others is because we were and are in our 10th year. I'll be 10 years this July, and Dr. Wooten was a major architect with me in creating Live Well San Diego. She was there from the beginning. And right from the beginning, we said this has to be our vision. This is now in 2008. And we were after and improving, at that point, not infectious disease, it was actually chronic diseases, which sadly, COVID deaths now have surpassed all other forms of conditions, health conditions, tragically. But we were after 2008 chronic disease. And we knew that it was bigger than even public health department. It required something natural that came to the work that Dr. Wooten and I did, particularly influenced through the HIV/AIDS era, about working in collaboration and working with community, not at community. And so we embarked on this journey of creating this not health strategy, but this wellness strategy about where health meets safety, and talking to components about natural built environment, which we call the thriving, and bringing that all together and braided in a way that is understandable and actionable. And so Live Well San Diego started with as a project, as a vision, but has now grown over the last several years as a social movement, where now we have, Dr. Madanat, we would have had our 500th Live Well partner actually last week. But that got postponed for all the right reasons. But we're almost at 500 Live Well partners. And this is really ties into that Live Well is a collective vision using cross-sector collaboration for collective impact. And so that cross-sector collaboration, we designed it with intentionality of working in sectors and industry sectors. And we said what's unique in the local government military sector is different than the business sector, it's different than the community-based sector. You know, it's different components and sectors and needs, right? From the school sector. And by the way, San Diego State was the first Live Well University partner. So I should say that for the record because of Dr. Madanat's leadership. And was bestowed, I believe, with Dr. Wooten when we had our Surgeon General there, and that was presented, which was a very special treat. So what these sectors have done in Live Well is that we have then taken them and just not these industry sectors, but then put them where people live. And so the old adage of it's where you live, play, pray, shop, and stay at home now, I guess, should be added to that. But it's neighborhoods. And so we've created all these sectors coming together in North County or South Bay or East County and Central. It's the community that lives together and grows together to effectuate the well-being. And our whole focus was really improving life expectancy and quality of life. Those are the first two drivers of Live Well, among 8 other metrics. And so to improve life expectancy and quality of life, we tackled chronic disease. And I'm proud to say, through the leadership of Dr. Wooten, you all, our public health movement, our population movement, we had something called 3 for 57 when we started, which was 3 conditions or lifestyles that cause 4 chronic conditions that lead to over 50% of all deaths. And back in 2008, it was 3 for 57. And those 3 lifestyles are lack of exercise, not eating well, and smoking. And the 4 chronic diseases are heart disease and things like cancers and things like diabetes and respiratory illnesses like asthma and COPD. And so when we then looked at that 75% of those conditions are actionable, meaning it's what we do to ourselves, genetics and access to care aside, we have made astounding improvements. It's actually now just dipped under 3 for 50. One of the first jurisdictions to reduce those chronic diseases, that is thousands and thousands of San Diegans that are living a longer, more quality of life as a result. So that has really influenced the way we operate here at the county with our partners. So it's no different than when a pandemic came crashing into our region, that we immediately activated our sectors, we call, and these industry sectors. But we've actually had to expand some because we knew that skilled nursing facilities was really a special place that was at most vulnerable based on what we saw in Washington State and other parts of the world. And so we created a sector for our long-term care facilities, and then we saw the importance also of another vulnerable group, the homeless. So we created a sector for the homeless, and then we also created a sector for the faith community. And so all of these sectors, through the amazing work of one of your best alumni, Carrie Riccatelli, who is here in this room, an alumni, Aztec alumni, is the leader for all these sectors that collectively has tens of thousands of people that it's influencing around the county, and calls that bring leaders and folks that are interested in working together. We mobilized that almost immediately when early on Valentine's Day, and I mean literally the next day, it wasn't difficult for us because we already had the partnerships. And we started pushing the messages that were very important from the public health officer at that time, which was cover your cough, wash your hands, stay home if you're sick. We had some powerful messages that I truly believe when the story is told in the years to come, they will roll back and say the early efforts we took with our sectors had deep human behavior impacts. So I think that's the power of population health in activation when you're dealing with something that encapsulates the entire county population. So that's how I would address how those industry sectors have really played a role. And I know Dr. Wooten has spoken to many of the sectors. I don't know if she wants to add any more, but I know they've been a blessing to us. Mm-hmm.
I think, and activating the sectors actually was Nick's idea. And it built on our relationships with all of the various partners we have in Live Well, and it leveraged all of those relationships, and maybe 4 or 5 major sectors became 16 sectors, and then 16 became, I think we're over 20, I'm certain we're over 20 now. But every time there is a need to focus on a particular population, we utilize that sector framework. And actually, we just did it this week with our laboratory directors for our hospital and community clinic partners, and then our commercial laboratories, as we are looking at how we can increase capacity. We have the capacity to test, but we have to live up to that capacity. So what is our capability of fulfilling our fullest capacity? And I feel, are doing a great job with the work that, since we decided to do this, actually was last Monday. And in that first week, we conducted a survey and then had the first meeting today. And the first meeting yesterday. We are meeting again tomorrow and then again on Friday with specific deliverables and goals for increasing testing across all of the various partners with our hospitals and community clinics.
Wonderful. Thank you so much to both of you. We're getting a ton of questions from the audience. So even though I'm sure Nick and I could ask Dr. Wooten a million more questions, I think we're going to turn it to our audience, actually, because they have some very interesting questions that I think, and many of them overlap. So I know that there's an interest in those. The first one is around binational efforts that are being done, and especially in focusing around issues of disparities in South Bay, where there are higher rates. You know, SDSU really prides itself on the work it does binationally, and so I think that's one of the reasons you're seeing our students also ask those questions. Is the work in the community is really an important one, and the border has been really impacted in South Bay. So there's a couple questions. One is specifically what is being done by national efforts, but another one is there a capacity to utilize the Live Well network more effectively to get the information out to diverse communities in different languages in a more timely manner?
Well, I'll start with talking about different languages. All of the health office's orders have been translated into threshold languages. All threshold languages except Chinese. So it's in Spanish, Tagalog, Vietnamese, and Arabic. And we are getting them translated into Somali as well too. And actually into all of there are 3 other languages that are utilized through our partner relay, which one is Quran, and I forget what the others are, but there's 9 total. So it was the threshold languages plus the other languages that are utilized by our partners in Partner Relay. Partner Relay is a program between Public Health and the Office of Emergency Services. When we have a disaster, we use champions from those 9 language communities to translate information and disseminate it, push it out into those communities, because we realized in 2011 when we had the blackout that some communities did not understand what was being communicated. So this was created so that we could communicate with our various partners that had limited English proficiency.
Also, great question about South Bay. Let me just say that we're in the Emergency Operations Center. That's what's called here in Kearney Mesa. It's our incident command. It's where Dr. Wooten is and I am located. When in the eye of the epidemic, the amount of data sometimes is swirling around you, and it's not often complete. It's fast, it's furious in how it comes, or how sometimes you wish it came. And so you're constantly doing meta-analysis, and the key is to be data-driven in your decision-making. And so evident yesterday, Monday, we started our first drive-up testing site in Chula Vista. There was a recognition that we needed to expand testing, because we have been working with all of our, the collaboration, all of our systems. I actually lead and co-facilitate with the Hospital Association, with Dr. Wooten's participation, all the hospital CEOs weekly. The chief medical officers are also together, chief nursing officers are together. Our now lab directors of our hospitals and clinics and commercial labs are together. And in the course of that, we were hearing clearly from Narav at Paradise Valley and Dan Gross for Chula Vista, Sharp, and as well as Chris Van Gorder for Scripps Chula Vista, and their experience, and watching carefully their data as well as the data that we receive from our emergency medical services, and working obviously with all of our clinics and partners in South. So we've been watching what's been happening on this side, which are those numbers in terms of regions are higher than others. Although we're not at a critical juncture, the numbers are higher there. And particularly for those 2 systems, more of their cases, COVID cases, are in their South Bay hospitals than their other hospitals. As a region as a whole, we're doing well. However, tragically, that is not the case in Baja. That is not the case in Tijuana. And so there's lots of growing concern, and I would say it's probably in crisis now, of where Baja was, and similar to New York City, when they were rising their apex, and I'm not sure where they are in TJ or Baja in their apex, but shortages of PPE and shortages of personnel. They seem to be with adequate beds right now, but critical needs in terms of staff. A fair number of their health workers have got infected and ill, recovering, thank God, but still, those are folks that are removed from the workplace. So there's a lot of relief efforts, a lot of charity. We as a county, because Tijuana is our neighbor, that is not a border to us, they are our neighbor. We work exceptionally well, and I'm proud to say that of our county with Mexico, but also our state. And so we elevated to Secretary Galley, to Governor Newsom directly about what we were hearing and the need, and activating the state assistance, and also with Congressman Scott Peters, and working with our federal delegation, elevating directly with them, and our vice chairwoman, our supervisor, Kristen Gaspar, actually provided correspondence, a letter to the Vice President Pence, being the chair of the federal COVID task force, about the need for help and assistance and resources for Baja. So we have made a very proactive ask, but as this is a federal issue, the only thing is the humanitarian efforts that are happening, and we're encouraging, and we have amazing partners in San Diego doing that, but it's going to require more. And I believe that we're hoping that our federal government is going to step up to support Baja, and I know those conversations are being had. But that is something we're watching very closely, and because we are one contiguous region, of what happens in Baja happens here. And so that becomes a very important topic. So I appreciate the question.
And Nick, if I could just add, in addition to bringing this to the attention of our state and the federal officials, on the ground here locally, our Office of Border Health and our Chief, Justine Kozo, I asked her to generate reaching out to our local partners on the ground to start looking at donations to Mexico or to Tijuana. And so that's one thing that we can do. We can't, obviously, we don't have additional PPE in San Diego, but we've reached out to our state and federal elected officials, and then we are reaching out to our local philanthropists so that those donations can be made as necessary and available.
Wonderful, thank you so much. One of the questions that I think comes to mind in circumstances like this is, what are some of the ethical decisions that you've had to make through this pandemic?
Ethical. Well, when you talk about ethics, the most common thing that comes to mind is the crisis care model, which is if we did overstep or overreach our capacity, then you have to start thinking about prioritizing resources. And thankfully, we have not had to do that. But we have a plan. So it's always good. The lesson there is always have a plan, but plan for the worst and hope for the best. So because of the actions that we took early on with social distancing, staying at home, we were able to, as that proverbial flatten the curve, we've been able to do that. And it's almost been like a double-edged sword, because we did flatten the curve. The capacity was not reached, but on the other side of the coin, with the capacity not being, with the hospitals not being full, then that affects their bottom line. So it's a double-edged sword in some ways.
So one of the other questions that we're getting from multiple people is, isn't it too soon to reopen our beaches?
I'm sorry, what's the question?
Isn't it too soon to open our beaches?
Too soon. Well, we didn't open the beaches. People can't go and suntan on the beach. They can walk through the beach. And we want people to be able to walk because that helps with the mental well-being as well. And then individuals that are going out in the water, usually that's a solo activity. So we're trying to walk the fine line here of not taking away things from people, but also protecting individuals as much as we can. So now that we have the facial coverings, and then on Friday that's going to be mandatory, but before then it was strongly recommended for the general public, but mandatory for 7 business employees in 7 businesses. Again, as of Friday, May 1st, facial coverings in public will be mandatory. Having it and then using it when you are within 6 feet of others that are not your household members.
Let me add to that, because some of you probably saw what happened in Newport Beach, and they opened up their beach and they really were violating the 6 feet distance order, and clearly it was an overcrowding. We've been really fortunate in San Diego, and I think part of the amazing response we have gotten is that San Diegans are coming together, and they're taking to heart those public health orders. And we don't have as much, clearly we're going to be watching it closely, but we don't have that as concern that people are not going to, are going to violate those public health orders and directives. On the contrary, we've been really pleased with the overwhelming compliance and support, it goes beyond compliance, support of San Diegans of doing the right thing and rallying behind and realizing that you covering up and following those public health orders is not only protecting you, it's saving the life of others. And I think that message is taken to heart. So it's really, every community is different, and we're blessed thus far in terms of how San Diego has been reacting. San Diegans have been responding to COVID-19.
We have so many more questions, but I want to take it, since we have a student audience, I want to take it through to the student aspect of it, which is, how do you anticipate careers in public health might be impacted by this pandemic in both the medium and the long term? So our students who are graduating next year and the next two expected to find work, and what type of jobs should they be thinking about?
Well, a couple of things. I think if you're an entrepreneur, I mean, there are opportunities, I feel, if you are an entrepreneur, for public health. Masks, one thing. This is going to be our new best friend, I believe, at least for the next year. And I was just talking with our Hala Crawford, who used to be the director, but now for EOC, but now she's a public safety general manager, and she had on this special mask, it was a mask that looked. She was saying that someone needs to create a mask that people can exercise in, because it was like an N95, but it was more rubberized. And it had the peak area. But if you have that type of ingenuity and forward thinking, I think the opportunity would be great there. Obviously, as a public health worker, the opportunities I feel are endless as well too, both in hospitals and in the public health sector. This is again an experience that hopefully you will only live once, because I don't know if we can go through stay at home another time in the next several decades, but I just think there is a lot of opportunity if you are artful, ingenious, and or visionaries, but also as a public health worker, there's opportunities, and you can do both.
Let me add to that and say, clearly, to echo Dr. Wooten, there will be new positions that are being created as we speak in near term, not far term, in public health. One thing that's fascinating in this pandemic is, tragically, in San Diego, we're approaching about a 20% unemployment rate, not to be grim. We have a large number of, numbers north of that for national employment. But the industry, when everything was contracting, that was expanding was public health. And so we've had to expand in some classifications, nurses. We're going to be expanding in these, in our epidemiology and these tracer roles. There are needs in the public health infrastructure. I just hope and pray that Americans don't become short-sighted and forget about that. And that, 1, 2, 3, 4, 5 years later, they're back to the old ways and forget about the importance of what public health has done. But I do think in immediate, there will be a interesting growth in public health. At least that's our hope and the indications from the federal government, state government, at least through the leadership of our state and locally. So I think it's a good time for us in public health. But it's going to be a tough time in the economy nonetheless. And our role in public health as we move still in mitigation, we're going to be dealing with recovery. And public health plays a key role in recovery as well. So there's always different facets of the life cycle of pandemics or epidemics, of what public health and the role public health plays. So there'll be different positions and different needs as we go along.
So one of the ones that came related to this one is, what is the county doing to prepare for back to work and contact tracing?
For contact tracing, so we have I call it an A and a B team. The A team is the team that does the case investigations. And then for each case, 3 contacts are generated on average. And then our B team, and it doesn't mean that one team is better than the other, it's just the name. The B team then are, as Nick calls them, the tracers. They contact those contacts of the primary case. It takes about 2 hours generally on average to interview the case, the person that's infected. And then once you collect the contacts of that person that's infected, those individuals are contacted by our B team, which are our contact investigators. And we are looking even at promotoras so that they can then do the every other day contact of the individuals that have had contacts with the actual case, because those individuals may or may not develop symptoms. They're going to be on quarantine for 14 days. If they develop symptoms, then we have to figure out who are their contacts. So if you could have a tree and branches, you have the case, then you have 3 branches. If 2 of those cases of contacts don't become infected, then they can go back to life. But if one of them or more of them develop the symptoms, then they become a case, and then we have to figure out who are their contacts. So that's why we need the staff that we need, and we are estimating bringing on another 350 or so individuals to work with the contacts.
Yeah, I think a cool name is disease investigators, but they are tracers, as Dr. Wooten just said.
Your answer follows straight into the next question that our students ask, is internship opportunities and assistance that they can provide to the county during this time.
Absolutely. We can, as a follow-up, provide you with a contact to come on as a volunteer. So that those opportunities are available.
And let me add also, this is for our health management policy students that are on listening in, but all our students at school, those that do internships, they're going to be a little bit more challenging because of just the virtual way we have to interview and so forth, and some hospitals in particular may be contracting because of, again, what Dr. Wooten talked about, of having to suppress on their own elective procedures because of being ready for the capacity for the COVID cases, and they've done a remarkable job. But they will be looking for volunteers, and some may be paid internships, but clearly volunteers, this is an extraordinary time where they would be very eager of listening to the support of particularly those that are doing an internship of sort. And also, I think for those that are graduating, an early congratulations to those, thinking about how they can add value and thinking about where we are and what's going on and what the new opportunities and assistance you can, as a newly minted graduate student in your various disciplines, can offer, be it county public health, county government, or community clinic or hospital or other healthcare organization. I think it presents definite opportunities in that.
Muted. We have a couple more minutes, and with the last question, it's to both of you. What are strengths that you look for in your staff and leaders?
Well, I'll start. I look for someone who can take direction and be self-sufficient, and know when to ask questions and don't just kind of continue on a path without asking and checking back. But for me, what I like to do is to have regular meetings and to check in. And I always like to start out with developing an action plan for the individual based on what their tasks are. So I look for someone who's a self-starter, who is a visionary and can bring new and different ideas to the table, but also can follow direction and know when to ask for help.
Well, I'll diddle that, but I'll add maybe a new other element to that. I call it the 5 Ps. And the first is I look for someone who is about people, is a people person, because we have to work always in, be it collaboratives or teams, everything we do in public health. There's no lone rangers. Even Dr. Wooten in her role works in teams, so a people person. The second is a person with purpose. And we all bring our purpose. And Dr. Wooten talked about her life experience and how that drove her purpose. And so I look for folks that, what is their purpose? And then tied to that, the third P is passion. Do you have the passion? Because often in our field, it's thankless. There's lots of critics, but you have to have the passion of knowing that this is personally gratifying, and this is doing the next one of the next P's. But the fourth P is performance, and that this is a person who does have the right attitude and skill sets and trainings. I mean, coming from an amazing institution like San Diego State Graduate School of Public Health. So the ability to show their performance. And the last of the P's is public good, that they have to be driven for public good. There's nothing wrong for those that go into a for-profit in business, and I say God bless, and we need the business sector. But those we're hiring are people that are driven, that the noblest motive is the public good. That is our Connie motto. And so we look for people that are driven by improving the lives of others, helping other people live well. So those are, I would add to Dr. Wooten, so what we look for folks.
Thank you both for your time this evening. I know it is late and you've had a long day. So we appreciate the time you took out of your really busy schedule to be with us. Nick, I don't know if you have final words to say before we wrap it up, since this includes also your students who you may want to send an additional message to.
Yes, I'll see you next week in class. But what I would say is also to the faculty and to the staff that are joining us in this virtual town hall, thank you. And what I would say to the students is, your faculty are amazing resources. And I always encourage that it's never too late, if you haven't really utilized the amazing talents and passion, those 5 Ps that the faculty have, is to make sure you align with those, because they will guide you exceptionally well, as they have done for many, many, many years, and for some of our newest faculty, clearly following the footsteps of our senior faculty. So my deepest appreciation to our faculty, our staff at our Graduate School of Public Health, and obviously the young blood of our profession, our students who are going to come in and take care of the rest of us as you become leaders in our field. And so thank you, Dr. Madanat, for your amazing leadership, your commitment to everything we do in advancing public health, and a live well champion, I must say, that you have been and have been appropriately honored. And with that, I'll leave the last words to Dr. Wooten.
Oh, no, I think, Nick, you've said it all with your 5 Ps. No, I just thank you for the opportunity to share with the students, and we hope that you are inspired and can find an opportunity to fulfill your passion, your purpose in this once-in-a-lifetime experience, which is the COVID-19 pandemic. So thank you again.
We're so grateful for both
Thank you.
of you. Have a good evening and stay safe. Live well.
Stay safe.
Thank you. Bye-bye.
Take care.
Bye.